Good afternoon in New York and Eastern North America. Good morning, Los Angeles, middle and the western parts. Good evening in Kigali and the rest of Rwanda, Africa and Europe. And welcome, whatever time of day or night, for all of you who are joining us from many corners of the world. I'm Yael Danieli, founder and executive director of the International Center for MultiGenerational Legacies of Trauma, ICMGLT for short. Thank you for joining our webinar on lifelong and intergenerational impacts of the 1994 genocide against the Tutsis in families of Rwandan survivors. This International Center for the Study, Prevention, and Treatment of Multi-Generational Legacies of Trauma webinar is held during the 100 days of the 31st anniversary of the 1994 genocide against the Tutsis in Rwanda. It focuses on lifelong and intergenerational consequences lived in families of survivors. Rwandan physical, mental, and public health professionals, child survivors, and child of survivors will share scientific, clinical, and behavioral findings, as well as personal reflections. These will include trauma-related alcoholism, psychosomatic, mood disturbance symptomatology, as well as of supportive and containing behaviors that promote resilience and health. Presenters will also reflect upon related social determinants and future challenges and implications. This webinar would not have happened without the total guidance of ICMGLT's Advisory Council member, Professor Donatilla Mukamana, and our board member, Dr. Mary Fabry. Your moderator, I, am a clinical psychologist, traumatologist, victimologist, and psychohistorian. Having developed the first program to help Nazi Holocaust survivors and their children in the 1970s, I have devoted much of my career to studying, treating, writing about, and preventing lifelong and multi-generational impacts of massive trauma worldwide, to ensuring victims' rights, the rights of future generations, and to reparative justice. For me, psychohistory explores history as it is lived by us today, this moment, not only as a series of dates, events, and names, but as it shapes our choices and ways of being now. Today's webinar's first speaker is Edmund Dufatanye, a certified group work practitioner with 14 years of clinical experience within inpatient and outpatient mental health settings. He holds a bachelor's degree in mental health nursing and a master's in public health. He gained clinical experience working with renowned professionals from Rwanda, South Africa, and Belgium. He's interested in addiction and believes that everyone has the inner strength that can be reactivated in afterlife stressors and challenges related to adversities. Today's second speaker is Dr. Giselle Umutoni Gashugi, a committed public health professional and medical doctor with a focus on maternal and child health, Giselle holds a bachelor's of general medicine and surgery with honors from the University of Rwanda and is currently pursuing a master's in public health, specializing in global health. She brings strong leadership and expertise in program coordination, health campaign evaluation, cost analysis, and strategic transition planning to drive impactful and sustainable health interventions. Third and last today is Antoine Hagenimana, a senior officer for the management of alcohol and drug use disorders at the Rwanda Biomedical Center of the Ministry of Health. Previously, Antoine served as a psychological counselor at Minubumbe, supporting genocide survivors. He holds an advanced diploma in mental health, bachelor's degree in clinical psychology and public health, and a master's in public health. His book, The Grief of My Mother, is a powerful personal testimony, and I am awaiting its arrival to ICMG-LT library. We have an hour and a half for the webinar, though we have been known for a most engaged audience who keeps us longer. Each of our presenters will speak for about 8 minutes. After an interchange among us, I will open the floor to questions or brief comments from the virtual audience, which also has a few surprises today. We will then conclude with last words. Please use the Q&A or chat function, and we will do our best to respond to as many questions and brief comments as we can. Feel free to direct your question to a particular panelist or to the full panel. I now have the great pleasure of introducing Edmund de Fatanye. Edmund, the screen is yours.
Thank you very much, Dr. Donnelly, and thanks to everyone who has been able to attend this webinar. It's an honor for me to speak about my professional experience and relating my experience working as a staff in charge of prevention of drug abuse at the Ministry of Health, the Rwanda Biomedical Center, and relate today's webinar, Lifelong and Intergenerational Impact of the 1994 Genocide against Tutsi in the families of survivors, with alcohol misuse among the second generation of genocide survivors, which I do believe that there is an unhealthy coping strategy to deal with transgenerational trauma. So for those who don't know about the traumatic event of the genocide against Tutsi, it stands as one of the most brutal, violent, and rapid genocide in modern history. More than 1 million of Tutsi were killed during 100 days, from 7th April to 3rd July 1994, which makes an average of 10,000 people killed per day, making it one of the fastest genocides in recorded history. So the survivors lived through mass killings, witnessed family members and near relatives being murdered. Women and young girls were exposed to sexual violence. it is estimated that 10,000 of children were born from rape. These children, often referred to as children of hate or children of bad memories, were born from the widespread sexual violence perpetrated during the genocide. The trauma lived by the survivors is also exacerbated by the fact that victims and aggressors lived side by side in the same communities and continue to live together with the government efforts to reconciliation. To this day, the impact of genocide against Tutsi is visible, particularly during the 100 days of commemoration, but also in the day-to-day life. During the 5 years working as a staff in charge of prevention of drug abuse at the Rwanda Biomedical Center, I did ask myself if the issue of alcohol and the drug abuse is not something directly linked with the past traumatic history of the genocide against Tutsi. As we reflect on the lifelong in the intergenerational impact of the 1994 genocide against Tutsi in families of survivors, I wanted to pinpoint the use and misuse of alcohol as one of the unhealthy coping mechanisms used by the genocide survivors to deal with traumatic memories of the genocide against Tutsi in 1994 and how it might have a long-lasting impact on the next generation. For the sake of time, I'm not going to go into details of the healthy coping mechanism, but we know that there are different health coping mechanisms, including storytelling and testimonies, community support and connection, where we have genocide survivors associations like IVUCA, AVEGA, and IAJ that helped people to connect, which is one of the healthy coping mechanisms, cultural and spiritual practices, therapy like trauma-focused, education and advocacy, memorization and remembrance, doing sport, journaling and creative expression, and mindfulness, meditation, and grounding technique. So if we do have time, maybe I'll come back with more details on this healthy coping mechanism. So because we are talking about the long-term impact, so I'm going to talk more about the unhealthy coping, because trauma often leads individuals to develop an unhealthy coping mechanism as a way to manage overwhelming emotions, intrusive thoughts, or physical symptoms. These behaviors can temporarily ease distress, but typically worsens mental and physical health over time. So unhealthy coping mechanisms often emerge as the constant threat that experienced by the genocide survivors of being killed, witnessing killings, seeing dead bodies, or having to hide for weeks in marshlands was an overwhelming experience. So the loss of property, being beaten and cut with machete, being orphaned, rape, lack of food, and aftermath living condition change with poverty, loss of trust, loss of motivation to live, psychosomatic illness, feeling of guilty for having survived, feeling of shame, fear, sadness, confusion, disabilities, being affected with HIV are the consequences that require coping strategies. So, and one of these unhealthy coping mechanisms includes use of alcohol and substance use. As survivors or witness might turn to alcohol and drugs to numb emotional pain, or intrusive memories, reduce anxiety, or escape flashbacks. I think that every Rwandese knows someone who uses alcohol in a manner that we can relate to self-medication, as the person is the only survivor in her or his family, or has not recovered from the consequence of genocide. If you did think that it is a behavior issue, please think again. So other unhealthy coping mechanisms includes emotional numbing or dissociation, avoidance, and the avoidance mechanism.
Edmund, are you moving your slides?
No, I'm not moving. So I'm using one slide.
Okay.
Yeah.
Sorry.
So, yeah, it's okay. The avoidance mechanism often develops as a way for individuals to protect themselves from overwhelming distress that reminders of the trauma can cause. These reminders could include people, places, activities, thoughts, or feelings that bring up memories of the traumatic events. So these are common in complex PTSD. There is also another health coping, which is silence and fear for re-traumatization. So I have added this health coping mechanism after having a conversation with Claver Irakoze. He made me be aware how silence speaks so loud. When it comes to the second generation, dialogue can have two impacts, either resilience or not. Those who were young and now are parents do not know how to have conversation around the genocide. From Claver's experience of how to transmit the memories of genocide, he recommends not to be a one evening conversation, rather to be a live conversation. So there is also low self-esteem in dealing with issues. I can relate to one of the young person who said, I don't know my parents because they don't speak with me. So other issues related to that indicate how brutal the genocide has been organized and executed, with the consequences of self-harm and also impulsive behaviors. So it's not surprising to see survivors' guilt and self-blame with a profound sense of guilt for surviving or not being able to save others. That can also be manifested among the survivors. So, and there is also internalized hatred or prejudice, where in some cases victims may adopt the oppressor's narrative, leading to self-hatred and division within community of survivors. So there are some scientific evidence that that indicate how trauma can be transmitted within generation because because of neurological changes, and the brain structure can be altered, like the amygdala, hippocampus, and prefrontal cortex. These are the region of that regulate emotions and impulse control. So what is surprising is how these ones are also involved into addiction. So in other part of the brain and include hypothalamic pituitary adrenaline that governs stress hormone like cortisol, and different studies indicated that people with PTSD are up to 2 and 4 times more likely to develop alcohol use disorders. And survivors abuse often alcohol to numb their emotions, as I have earlier mentioned. So adverse childhood experiences are also one of the traumatic events that is likely to be linked with alcohol. So, and there are other studies conducted as part of epigenetics that indicate modification to gene expression without changing DNA sequence. So if we look at the studies that were conducted in Rwanda, I'm going just to highlight only 3 among many that have been conducted. So the Rwanda Mental Survey that was conducted in 2018 was involved youth and adults aged between 14 to 65 years old, revealed a prevalence of PTSD among genocide survivors to be 27.8%, and it was 3.6% among the general population. So for alcohol use disorders, the prevalence was 4% among genocide survivors, while it was 1.6 among the general population. So it was almost 3 times higher among the genocide survivors. So other studies conducted, the ones that I'm going to highlight didn't focus on the genocide survivors and the general population. But this one, the second Rwanda NCD risk factor, conducted in 2022, was done among the youth aged 18 to 69 years old. So it was about assessing the risk factors of non-communicable disease, and they revealed a consumption of alcohol in the past 30 days to be at 48.1, which was found to be an increase of 6.8% from the 2013 study, which was at 41.3%. Another study that was conducted in 2022 titled Drug Abuse and Substance Abuse Among Adolescents, that was conducted in 7 districts and was done on youth aged between 13 to 24 years old, revealed that alcohol consumption in the past 30 days was 28.5%, and the lifetime use was 56.1%. So in general, the study established that the main cause of drug and substance use in the 7 districts is the disintegration of families of majority post-genocide youth, especially where parents and adults mistrust the youth. Parents' history and wounds are also indirectly impacting the behavior of majority of the Rwandan youth. So it is well known that the Rwandan government is very conscious and aware of the extent and consequences of the drug use, and has established an interministerial committee responsible to coordinate all efforts in drug use prevention and rehabilitation services. The youth has been also the target through inzoga si z'abato, meaning alcohol is not for young people, and tunywe less or drink less campaign for those aged 18 years and above. All these strategies should be trauma-informed if you understand the intergenerational trauma. So intergenerational trauma transmission through family psychosocial style with reactive abusive communication, indifferent parenting, nonverbal, and guilt-inducing communication. Some parents might compare their lives with the ones of their offsprings and deny recognizing their emotions. Studies suggests that parents' PTSD symptoms could contribute to harsh parenting practices, such as childhood maltreatment, and in turn increasing risk for PTSD symptoms in their offspring. So it is important to note that DSM-5 has added criteria for PTSD, which was not in the DSM-4. I need to highlight two among these ones. One is reckless and self-destructive behavior, and another one is persistent negative emotional state. These two can explain one of the questions I have been asking myself when working as a staff in charge of prevention of drug abuse and thinking about the profile of those who abuse alcohol and drugs. To conclude, I have worked for 5 years as a staff in charge of prevention of drug abuse at the Rwanda Biomedical Center, and I have met with different people. We have talked about effective strategies, but I did go to think about the link between the use of alcohol and the genocide a bit late. And this webinar is an opportunity to explore more about this unhealthy coping mechanism to inform ourselves on how to restructure the strategies, recognizing the lifelong intergenerational trauma. We should bear in mind that when working with the second generation of the genocide survivors, there is higher likelihood of alcohol use among the genocide survivors to cope with the traumatic memories. And this is one of the unhealthy coping mechanisms that has long consequences. Because once you try to use alcohol to cope, you are likely to end up being addicted. I would like my presentation to be a call for everyone who supports the genocide survivors in their recovery to consider alcohol use as one of the lasting imprints of the consequence of the genocide against Tutsi, not only for the first, but also for the second generation. Community mental health interventions should focus on both the first and the second generation of the genocide survivors. Trauma-informed approaches should be the guiding principle in preventing and managing alcohol use. We need to recognize the intergenerational trauma and make the mental health services available, accessible, and acceptable to the second generation of the genocide survivors. We need to create social safe spaces for the second generation of survivors to enhance resilience. These social safe spaces would help the second generation acknowledge grief, learn how to manage emotions, forgiveness and reconciliation, and envisioning life goals. So I am grateful to the ICMGRT and the board who devoted their time to make this webinar and to remember those who were killed during the genocide against Tutsi. Twibuke, twiyubaka, remember, unite, renew. I thank you.
Thank you very much, Edmund, for your thorough presentation. I hope that in the future studies, you will also use the Danieli inventory, which exists in Kenya, Rwanda. And it connects not only to the 1994 genocide, but even to former conflicts and issues. So it tries to figure how much of a weight history has contributed. Thank you very much. Your presentation also served as a good introduction to the whole panel, so that is excellent. Dr. Giselle Umutoni Gashugi, the floor is yours.
Thank you. Good morning, Good afternoon, good evening to everyone. My name is Dr. Jose Mutoni Gashugi. I am a survivor uh, and a bearer of legacy shaped by both deep loss and immense strength. I was born during the genocide against the Tutsi. My father was killed in that tragic time. And my mother, a survivor, raised me alone with grace and determination to raise me well and to educate me. Uh, she gave me a very special uh, seed of education. She planted the seed of hope into the grave, the soil of grave. But growing up, there was one silent topic in our home. We never spoke about the genocide. I had so many questions as you can think of, and I was too afraid to ask those questions. My mother carried all the response for me, but she was not yet ready to give it up to me. Uh, the pain was too heavy, too sacred, and too deep. I remember feeling an indescribable sadness in my body, a knack with no name. I developed psychosomatic symptoms. I couldn't understand why. I only knew that something in me is mourning that I didn't even understand at time. Eventually, with the help of a clinical psychologist, my mother and I were able to begin to open a door that had been locked for too long. That journey brought me for the first time to the memorial site where my father is buried. It was one of the most important moments of my life. My mother had promised me she would come with me to remember my father, but that day she didn't come because she was sick. I was sick every time in the commemoration period. Uh, when I went there alone, my mother sent me a message while there on the memorial site. She sent me a message, said, umumbwirire ko iteka iyo mubonye mwibuka murasa. If I can translate, it's like tell him on my behalf that I remember him every time I look at you. You look alike. That one sentence carried all the love, the memory, and the unspoken sorrow that my mother carried, but the word had not yet expressed for the decades. My story is not only mine, it is my mother's, it is my father's, it is for it is the story of many of us who carry invisible wounds across generations. Uh, while searching answers to the painful questions, I did picture myself with all those young people who were born during the genocide or right after the genocide. And I tried to remember, and I imagined maybe, as for me in genocide, my mother carried me in her womb. Some of the pregnant woman was killed with their babies in the womb. Not they, there are many who were killed in genocide, but we never remember them. We never knew them because they went while they was still in their womb. And I tried to imagine maybe I would even been die. I would never been born. What if I started questioning these images of those who were killed? Maybe I would be among them. Then me and my colleagues with the same age, we started a group to remember those who were killed while they were still the babies, the newborns, and those who were killed in the mother's womb. Now, from that from that moment, now in our country, we have the specific time to remember the women and children who were killed during the genocide against the Tutsi in 1994. But if trauma can be passed down, I, I hope that so can resilience. Despite the silence, my mother gave me strength. Despite the pain, I stood up. I became a medical doctor. I completed my medical school and I pursued my master's. I participated in different things, initiatives in my country. And every time I feel the weight of the past, I make a vow, not of revenge, but of remembrance through living. I choose to rise, to live well, to succeed. That is my form of resistance. That is how I honor those I lost and those we lost. Because our story, my people's story, must never be forgotten. It must never be perished. I'm grateful to those like Antoine and others who had those courage to write down our story so that it can be fed out. Uh, and I hope that the world will understand the truth of the genocide and the bad side of the genocide because it never ends by the first generation, those who saw it. I even, my own child asked me, where is Grandpa? Where is Grandpa? I told them that he was killed in genocide and which is genocide? What is genocide? Who did this? Who, and that is the way the trauma is transited even without knowing, without noticing, and without wishing to give the the bad news to our next generation. So I have a message to those who are like me, to those who feel the pain they cannot name. Know this: you are not broken, you are not alone, and even in silence, love remembers. Seek help, the professional help, because as for me, I had those resilience because I sought a profession on time without uh, distracting myself much. And I would also like to thank the organizers of this webinar, as it is a good platform that keeps us remember our beloved ones, honor their lives, and commit ourselves to fight the genocide ideology wherever it can come from, and say loudly, never again. Please, Jami, ntibizongere. Thank you.
Thank you very much, Giselle. Thank you for courageously sharing a piece of your own life with everyone um, in a way such that we can really feel how it was like to grow up as you did. And thank you very much for the message. And indeed, and this is part of why I want the researchers among you to use the Danieli inventory, silence is part of what we found to be detrimental. Yet it's not part of what we usually talk about. So this is extremely important for not just for our Rwandan family and community, but for the world community of survivors. Thank you very, very much, dear.
Thank you.
Last but not least, please, Antoine, we're very excited to hear your own presentation. You realize we moved from a survivor to a child of survivor back to a child survivor presenter. So go ahead, Antoine. Please unmute. Antoine?
Yes.
Perfect. Go ahead.
Thank you. As I said, my name is Antoine, and not the author of the book called The Grief of My Mother. This book, it's my own story during genocide, and shows how trauma can be transmitted, and also how the resilience can be also passed across generation. This book describes how my own and my mother's deep silent grief after was how my mother survived during genocide against the Tutsi, and how my mother shaped me based on her emotional and her unspoken trauma become part of her children's. So, as I said, I can say that during genocide, before the genocide, I was what I can say, I am an example of the powerful resilience that also passed from one generation, because resilience can pass from one generation to another. I was born in Rwanda, in Western Province, into a family full of love and peace. My parents loved and supported me. I had a happy childhood, feeling with loved and secure. But when I was only 3 years old, my life changed completely, because my father died suddenly when I was 3 years old. Also, losing a father at such young age felt like a tree losing its roots. Because of our culture, I was taken away from my mother, and I have to live with my paternal family. My paternal uncle raised me, even though they gave everything I need physical, everything I needed physically, but my heart was empty, because I missed my mother deeply because she was away from me. Later, my mother married another man and had 2 more children, although it was painful not to live with her. Sometimes she secretly came to visit me near my primary school, where she gave me fruits. There's a secret moment, even though short, gave me great strength and happiness. But after she felt, I always felt a deep pain and longing to live with her. During genocide, 1 week, there are many painful trauma during genocide against the Tutsi. 1 week before genocide started, both my paternal uncle and aunt died. Then the genocide started. My whole paternal family was at home. While genocide against the Tutsi began, I was 11 years old. I experienced the terrible because my whole family was killed. Only my 3 years old cousin and I survived. Witnessed things no child or human should ever see. I saw in my family, or my family, beaten, hacked with machete and killed. I hid for a long time in fields and bushes, running for my life. I fled Etikanga Parish for protection, but on April 19th, 1994, the killers came and killed almost everyone at parish, the health center, and even priest and nuns' house. That day, they burned the parents with porridge and cut open pregnant women. I survived because men defended the place by throwing stones. Then heavy rain fell, forcing the killers to leave. The next day, I went to Kamembe commune, where my mother and grandfather, grandmother, uncles, and aunt was hiding. Immediately, another group of killers attacked. They killed all men and boys, but I survived because I was wearing a dress and they thought I was a girl. I watched as my uncle and grandfather were killed in front of me. Later, I was separated from my mother again, but they took us to the Nyarushishi refugee camps. And there, my mother finally found me. She was no longer the same mother I knew. I later learned that on her way to Nyarushish, she was attacked by killers, beaten, and raped. After genocide, I realized that the body of my mom was free of invisible wounds. Her heart was heavy, breathing itself was a burden to her. She would cry suddenly, get angry over small things, and had many deep secrets that she could not talk about. As you see, living with a parent who survived such trauma is not easy. And when the pain is not healed, it can be passed down from one generation to another. We still see this today in our work with young people who survived who are suffering from trauma without knowing it. My mother passed her pain to me because a child and a parent are emotionally connected. My mother, but even though my mother faced the painful circumstances, she taught me to stand up and be strong. Even after she had gone through, my mother never gave up. She rebuilt our life with her own hands. She raised us with dignity. She pushed me to study hard, and now I have a master's degree in public health, 2 bachelor's degree, and I am also preparing for a PhD. She often told me, byuka ujye ku ishuri utazaba imbwa. So it means get up, go to school, so that you will not be a coward. She taught me to dream big, to believe that life could offer good things even after great suffering. From her silent strength, I learned that surviving is not just staying alive, but choosing to have hope. She taught me to not let hate steal our future. Her resilience is the greatest heritage she gave me. It made me continue studying, and now I became professional in mental health. And also, I wrote my book, The Grief of My Mother, to tell the world the price we paid, but also the strength we gained. Today, if we look at my life, I see both my wounds and also my victories, but the wounds have not the power over me anymore. They become foundation of my strength. Today, I'm also as demonstrating my resilience. I'm also a father of 25 children of a group of old student genocide survivors, GIRG. I have also important responsibility, working at a national level to fight against drug abuse and support youth with special need. My story is not just my story, is the story of thousands of survivors, children survivors who are still building their life today. I'm a witness to all children who are now frustrated. And I say to everyone who's still suffering that life it is possible to heal. It's possible to live in a good life again. Seek help and we can change your story. As I finish, today I stand here to thank my mother, to give respect, and to thank all the parents who survived not only for themselves but for their children. Their resilience, battles, and untold strength are the foundation we stand on today. The genocide tried to destroy us, but we are still here. We remember, we rebuild with love stronger than hate and with stronger than despair. Thank you, everyone who participated in this webinar. And as we write our story, we have to make a struggle and to have a combat or to make a good life, and also we have to be against genocide ideology. Thank you.
Thank you, Antoine, for your very moving presentation and for the message of hope. And indeed, someone is asking, Caroline Walter is asking if your book is already available. Is it available?
Yes, the
If
book.
it is available, please put in the chat how people can get it.
Yes.
Okay, this is because people are looking for the messages, all the messages in this webinar, both the vulnerabilities and the strengths, right? Both the unhealthy coping mechanisms, as Edmund specified, and the healthy ones, and the message of hope. And one of the yeah, people have been moved to tears actually by these amazing presentations. And your presentation, Antoine, as you can see in the chat, and Giselle as well, and of course Edmund's comprehensive picture. I think because April is Genocide Month, and because last week was also Holocaust Memorial Day, we had a very similar message there too, how the survivors are always inspiring, and the stories of the survivors inspire people's lives today and gives them hope and strength. So I think we can, so what I'm sharing is it's not only in Rwanda. We are really finding this across the world, but you articulated it so well. I know that Giselle has to leave at in 15 minutes, right? In 12 minutes. So if anyone has specific questions to Giselle, this is the time to ask. But otherwise, before we go to questions and answers with the audience, please, do you have any questions of each other? Any comments on each other's presentation? Edmund, you listen to your colleagues. Is there anything you would like to share in listening to Giselle and Antoine? And it's the same to each one of you, please.
Yeah, I have said to Giselle that she has been courageous to share her story, because this is not the first time she has been aired on one of the radio in Kigali, and then she has met those kids who were killed with their mothers, not to be forgotten. That is well said, and I really give credit to her. And I would also to give credit to my colleague and friend, Antoine, with whom we have worked for a few weeks, and then to tell him that it took me time to link trauma and alcohol misuse within the second generation. So, and I will be on his side in developing something specific to the second generation, because we used to be misleaded by some literature, which we did not focus on how even alcohol misuse can be one of the unhealthy coping mechanisms among the second generation of trauma survivors. So I really, I have thanked everyone who participated, but I did appreciate my colleagues, Antoine and Dr. Giselle. Thank you.
Thank you, Edmund.
How about you, Giselle? Any thoughts in response to your colleagues, or any further thought you would like to share?
I would like to comment on the presentation of Dr. Edmond. Sometimes in our culture, we are not used for these mental health things, and you know, it's like we have the culture to keep everything to act to for ourselves. We say no kwimeninda. So sometimes um, it is hard for the young people who don't even understand what is going on in their bodies, in their emotions, in their mental health. I think it is also good that I am also a medical doctor. Uh, from my experience, I even had to receive some patients who are in the same status as I was in the past, and I started to tell their parents that they need the psychological professional help because as I am a medical doctor, but I can't help them in the psychological pathway because it is a process. It is a big process. Sometimes we need to look at someone as holistically because someone could have consumed those drugs, abuse different sorts of drugs, but if you tackle on the issue, psychological issue he or she has, everything is sorted out. He can in the normal life and he can become someone. As I told you, I am among those that uh, that are the good outcome of the psychological help. So in our culture, it is not well known as a medicine. Someone who seek the psychological help, they call him a crazy man. But it is not being crazy. Everyone needs that help. As someone could need paracetamol, could have malaria, fever, it's also normal to have a mental health issues. It's not being crazy. That's I think as a psychologist and mental health professionals, you have a big role to play to tell the people, to tell the population that it's not for the crazy men because it is well known for the crazy men, but it is not for the crazy men. It is for everyone, I think. Thank you.
Thank you, Giselle. I told you there's some surprises in the audience, but before that, Antoine, anything you'd like to add to everyone on the panel, and then we'll go to questions and answers from the audience.
What I can add is only to thank my colleagues, especially Dimo. I have worked with him within like 3 months or so, but I have learned many things uh, because Dimo is very intelligent, scientifically, especially.
That's very clear.
And when I met Dr. Giselle, I have seen that she's a powerful woman. I think I proposed her and I discussed her to participate in this webinar because I have seen that she can be a model of many women or many persons who have problems. She sometimes inspired me with her dreams, which is a powerful one. Also, as what I can also add is the powerful was the necessity to share our story, our testimonies. I think we have to preserve our memory and the truth for future generations, and also promoting resilience among survivors also, and breaking the silence around the mental health challenge caused by our painful circumstances. And also, we need in our story, we emphasize or we emphasize or we have like empathy, and we are example for other persons who still struggling with lives. Finally, we have also to combat genocide denial. Thank you to everyone. For me, I'm very satisfied, and I think we have to continue this journey to tell the world the truth. Thank you.
Before we save the world, let's answer some questions from the audience. Claudine, if you promise to be very brief, you have a question to Giselle, but please be very brief because she has in 2 minutes to leave us for her work. So, Robbie, would you help Claudine have the...
Sure, thank you. Can you hear me?
Yes.
Okay, beautiful. Thank you very much. Mukobwa agitare witeka gumugisha bambwiye ngo mbe brief reka ndase
We
kungiza.
don't have, Claudine, unfortunately, we don't have time. Hi,
my question is about how do you tell your story to your children? Because your story is about how you survived genocide, the pain your mom is going through, and then how you lost your father. How do you make sure that by sharing your story to your children will not make them break down, and then also will not make them hate everybody or hate the people killed, their grandpa? Because my mom, she survived the 15/9 genocide, and then when she had us, she could not share her story with us. So we found out what she went through during the genocide when she had to tell us to hide. So she was a fear to share her story. So how do you make sure to share your story, and then your children, they don't break down, and then also they don't hate people? God bless.
Giselle, any thoughts? Thank you, Claudine. This is a very insightful question indeed.
My pleasure.
As you always ask those. And you always teach me. You always teach me. Giselle, would you take a chance at answering? And all three of you, this is a very important question. Go ahead, Giselle, you start.
Okay. Thank you for your question, Dr. Claudine. But as for me, I'm not sure. That's how I said it is translated without even knowing, without even wishing to translate the trauma from one generation to another generation. I think that's the bad side of genocide, because we don't have any other choice to tell our children about our history without affecting them. As for me, when I tell them, I'll tell them that during genocide 1994 against the Tutsi, They have some people Hutu who killed the Tutsi, but as that everyone Hutu is not didn't do the genocide. That's the only way I feel I can tell them how everything happened, because my oldest girl has now 8 years old, and as you can know, uh, those ages they have too many questions. They have too many questions. Sometimes you don't know how to respond, but that's how I say them, because I told them, because they even hear from the television, radio, everywhere. And as for her, I carry even her to the memorial site to remember her grandfather and the other family members who were out there. Uh, so she knew that the genocide against the Tutsi was Hutu again killing the Tutsi, but that every Hutus didn't kill during genocide. That's I'm not sure if I responded well as you wish, but that's the only answer I have. I'm not sure of if I'm not translating the trauma, or if I'm translating the trauma. I'm not sure, and I think that's also how I got me myself the trauma from my mother. Yeah.
Thank you. Go ahead, Edmund.
Yeah, thanks, Dr. Rodin. It's not an easy question because you don't know how to start the conversation. But as I have learned from Clavel, the silence speaks louder. So somehow it's very important to, what I have learned from Clavel's book is that you have to talk first about how life was before the genocide, because we know that people were living together, were supporting each other, people were lovely, and the process of that led to genocide is because of the government. So the government planned and executed genocide to the extreme extent where even parents turned against their kids. So that is what is tricky. So I think that it's very important to look at the age of the kid. Mine are 17 and 15. So sometimes I even ask them what they know already. So, but it's a process. So, and when it comes to what I feel proud to say is that I could say that is the past. But at the same time, when you look in the neighboring countries, you might say that maybe my kid will say that you lied to me, because the past is no longer something that we can say the past is the past, as long as there is genocide ideology. So, but it's very important to avoid creating fear to the kid, because he might be reluctant to talk to other kids, thinking that maybe these are the bad people. So, but it's something that cannot be done in one night. It's a process, but it's not easy. Honestly speaking, it's not easy. Thank you.
I would go.
I wanted to say something. The
Please,
first
please,
time,
please.
yeah, the first time even I talked with her about the genocide, um, I was shocked when she told someone else. She said "Urumuhutu," saying you are a Hutu, and shocked. I asked her why. Why did you tell her like that? She said she's not a kind person. And I listened in on TV that Hutu killed the Tutsi, so the Hutu are not a good person. And shocked, I knew that maybe eventually I was even afraid that she can say it at school and tell other students that that word, and you know that is not good in our country. I started to explain that the things in genocide are not the same as we are living in nowadays. I told them about genocide, who did this, but Hutu is not the character of a killer or a bad person. It is a, even there are some Hutu people who hired some Tutsi and they are the good person. And that's how, that's the difficult part of genocide I faced when I was raising my kids.
Let me continue with another question. All the questions are related to what you're bringing up. But there's a question, what are the challenges in blockages that prevent second generation from acknowledging their trauma and then from seeking help? Go ahead, Giselle.
Sorry, come again. I didn't hear well the question.
Yes, it's a very important question. And of course, it's related to the silence we spoke about. It's related to cultural and social issues. What are the challenges and blockages that prevent second generation from acknowledging their trauma and then from seeking help?
That's the only issue we have is or a barrier we have is our culture. As I said, in our culture, we have to keep everything for ourselves. Our stories is our story. Our victory, our wounds, our everything is kept in ourselves. So speak out is not our things. It's not in our culture. And seeking help from the psychologist, as I said, there is a stigma saying that those who are seeking help from the mental health, it is the crazy, those who went crazy, and those in our language called abasazi. It's low trauma and schizophrenia, they don't differentiate. Everyone who seek, they think that everyone who seek the mental help is those also only who have the schizophrenia, those diagnosis called schizophrenia, and all other crazy things. But for the normal person who had issues, who is struggling with coping with any situation in our culture, everyone must deal with her own situation on her own, or her people's, her family. And sometimes the family didn't understand what is she going through. I remember when I was struggling with my mother, asking her questions about my father, where is he buried, and all of that. he was thinking it is not that important. She was saying, why? Why are you asking that? Your father is dead. You knew it. So you have to study. You have to focus with your study. You have to focus with your future. What's the matter with your father? So they don't understand that it's a normal process for someone to, and we can have the same issue, we can meet the same, pass through in the same situation, but the way we cope with it is different. I can be resilient and some other one is not, and I don't understand why. Why can she cope with this situation? It is easy. I passed through and I didn't have any issue with it. Why? And they think it is dramatization. There is that stigma. To cut it short, I can say it is our culture and the stigma with the mental health.
Anyone want to add to that, Edmund, Antoine?
Yeah, what I can add is that when we are working in individual session with people who have faced challenges and are living with trauma, so there is something that we call normalization. So, and we let the person know that what she endured was abnormal, but her reaction is normal. It's the same thing that we have to do with our community, because they have to understand that being weak, it's something normal. It's not about being having signs of weakness. And I have seen that now where I work, we do have education with people who are young, who are educated, who have some socio-economic status. But the way we speak with them, encourage them to seek help. But it's something that has to be done on a continuous level because once we go out to speak about stress, we speak about how our culture sometimes does not allow us to speak out. So we find that people do really understand. So it's not about waiting in our offices and in our consultation rooms. It's all about going to meet people and to offer for our services. Thank you.
Thank you. Excellent. Let me go on to another. Samir Jamil is sharing with us, which some people in the audience would know. Thank you, Samir. After any kind of trauma, we expect high levels of oxidative substances resulting from oxidative stress. Moreover, PTSD can affect HbA1c levels, increasing to near or post pre-diabetic or diabetic states. Thank you for adding that layer of discussion. And Lois Bernard, hello again. Dr. Giselle, but probably also Edmund. Are there any physiological effects that you have seen in survivors or their children? Go ahead, please. I think you touched upon it, but please share. Can you think?
Yeah. As the physiological effects that I never noticed is that uh, I they later on develop other like hypertensions, diabetes, and all those issues related to stress and hormonal disturbance of their bodies. And that's the only issues. But it is a long term, and for some, in our career, in our profession, some of my colleagues, we don't understand. They may have the physiological issues which we don't even understand scientifically. When we do the tests, when we do everything, when we do the physical exam, there is the pain, there is uh, some deformities or some issues. But when we look at the investigations, we don't see anything. Everything is normal, everything is negative, but the patient is in pain, the patient is not improving. Sometimes we don't understand why. Um, Later on, they can develop those diabetes, hypertension, due to high anxiety and depression.
Thank you. Edmund, do you want to add anything? Or I think it covers it, I think, pretty much.
Yeah, we for those who are in Rwanda, they know that sometimes we do face challenges of having adolescent people in schools are having symptoms where they can't stand. So, and we refer to mass hysteria, but it's something that is very linked to the family living conditions and the unspoken pain. And most of the time, where youth, they are living in a world where they just want to challenge adults' behaviors, but they face the challenge of not having us who can really easily express and help them to express their emotions. So, and we know that there are some psychosomatic disorders, as Dr. Giselle said, and also anxiety. So there is no study that I would refer to it that highlights how the the data relating to the psychosomatic disorders, but it is something that is somehow even contagious. So when you see one case in a school, particularly boarding schools, so I don't know how much these kids who are in boarding school who are much more affected than those who are living with their parents, but the living conditions from the school and also from their families does contribute a lot in developing psychosomatic disorders. Thank you.
Yeah, there is one who asked about how we can help those who didn't have that resilience as we had. The only way to help them is to speak out and to tell them that they are not the only one who went through all those they went through, and that someone had the courage to come from that painful past and become someone. I think that's the only help. And if we can have we can be lucky to help them like physically, we can help them to pass through because someone always need if someone is mourning, he thinks he or she is alone. And the most important thing is to get to understand that there is someone who can understand you, who passed through those traumatic situation, and who came through that throughout and become someone. I think we always need someone as a uh, that's how we say a role model maybe. Uh, Someone that you live on. You say maybe if Dr. Giselle made it, I can even me also I can make it. That's the strength we can give them. Thank you.
Thank you, Giselle. Stuart Leiderman is asking an interesting question about a particular study. You can see it in the chat. Thank you for your ambitious, necessary, and continuing effort. My question is, and he gives the link to the study, so those of you who are researchers might very well be interested. I already copied it and will add it to our library. A study that came out, the findings came out April 2014, and he states, our study did not identify an association between children's psychopathology and maternal traumatic experiences and maternal PTSD. Instead, a significant relationship was found for children's psychopathology and their experienced maternal violence at home. Therefore, to what degree is the matter of 1994's contributing factors to today's children behavior and mental health being debated and still researched? Hold on, it keeps jumping at me. Thank you to and for all survivors. And I'm very happy, Stuart, that you're giving us also your email address. Again, before, do you want to take that up first? And I will also add some stuff. Go ahead. Anyone wants to take that up? First of all, are you familiar with the study? Edwin or Giselle? Stuart, do you want to join us online? I don't know why I'm reading it for you.
Yeah,
Okay, go ahead, ask the question and specify who the researchers were. Robbie, please let Stuart speak. Stuart, go ahead. Stuart, you're on. Is he
okay.
still? Oh, good. Yeah, go ahead.
I was passing through the abstract of the link that he shared. They did the research on the transgenerational consequences of PTSD, risk factors for the mental health of children whose mothers have been exposed to the Rwandan genocide. They said in conclusion that contrary to the simple model of transgenerational transmission of trauma, neither maternal PTSD nor maternal traumatic experience were directly associated with symptoms of anxiety, depression, or antisocial and aggressive behavior in the children. Instead, the present results suggest a relationship between parental-child rearing practice and children's mental health. Furthermore, the study details the cycle of violence, showing a significant link between maternal violence against a child and its mother's experience of childhood maltreatment. So I think this is the point. The transgenerational trauma is not like the mother is traumatized and immediately the unborn children or a born children is traumatized immediately. The pathway or the channel in which the trauma is transmitted is through that conflict, that maltreatment that the research concluded. They concluded that the mother who was pregnant maybe during genocide against the Tutsi, those children who were in the womb of their mothers, they didn't receive the trauma immediately, but through the pain and the trauma and the wound caused by their mothers, the relationship after in their lives after the genocide is where the trauma is transmitted, is when is the trauma is transmitted. I think that's how I can respond to his question. We are not like saying that the trauma is transmitted during uh, the genocide immediately, but of course, as we shared our own testimony, me and Antoine, we said that we had a hard relationship, a silent relationship with our mothers because they don't want to speak out what they passed through, and that we carried too many uh, questions in our minds that we didn't find the response to, and the relationship, how they treat us, the severity, the way they do things, the way we talk, the way we exchange our ideas. That's how the wounded hearts, the wounded souls of our mothers transmitted their trauma into our lives. Why? Did I reach to the point to have the psychosomatic uh, diseases? It's because I had too many questions about my father, about my family, about my grandpas that I don't see. And my mother, when I asked those questions, she doesn't want to respond. It is a closed door of her life that she didn't ever wanted to open and to speak about. That's how I get being traumatized. Thank you.
And it's not when silence covers up the trauma nonetheless shows itself in all kinds of other ways. If it's not through speaking, it would be through the body's expressions or through social behaviors or misbehaviors that are not obviously related to the trauma, but are related to the trauma. So I would want to read that very carefully, but part of why we created the Danieli uh, inventory for multi-generational legacies of trauma is to think of the effects as affecting the way we are, the way we live, not just by clinical diagnoses, because they simply don't capture. They're not supposed to capture, but they definitely do not capture how trauma affects who we are, how we wake up in the morning, how we eat, who we eat with, or do we eat alone, etc., etc. So please, Stuart and everyone, and particularly the researchers among you, go to in our website. There is the Danieli inventory in many languages. There is a totally available, stunning uh, version in Kenya, Rwanda, by Grace Kagoire and Etienne and Raquel. There was by a whole team of excellent Rwandan multidisciplinary researchers. And I think you would find the answers you're looking for there by, even though it's a long survey, but it's worth it. It's exactly, Edmund, that's part of what I mean. That trauma is not always expressed in a clinical way. That's right. Why should it? life is life, right? We do our best to live our lives after trauma.
Yeah.
So please attend to that. It's very promising, I promise. I want to go to some other questions because, as I told you, our audience is so engaged. So there are two questions on sort of a governmental level. Hashim Yusuf is asking, what is the present Rwanda government doing now to resolve all of these psychological problems? And there's another question, sort of related, by Dinka Korkalo Biruski. For all panelists, would you say that the example of how Rwanda is dealing with the legacy of genocide is a good one? How is the genocide presented in schools, and what do children learn about it? So you can take either one of these, and please share your wisdom with us. Go ahead. Who wants to be first? Antoine, I think you have something to do with the ministry. Why don't you begin?
What I can say, our government is doing many things, especially even though we survived, and Rwanda has many, our population has many problems, like as the more presented some researchers and about depression and PTSD. Our government have tried to make availability of the services, for example. You know, in every health center, we have mental health professionals like psychologists or mental health professionals or mental health nurses. Also, when we go to the district hospitals, referral centers, we have referral centers, especially which is dealing with addictions on drugs, about drugs. So we have many settings, and every Rwandan can join to search to look for services. For example, also in nowadays we have a program, especially a good program of school-based mental health, where they deal with like transgenerational trauma. As Dimo said, our adolescent have many questions and face psychological problems, mental health problems. So as we are now dealing with some training in every school with two, and we trained two school counselors, women and men, so that will help. And also, the government created some ministries like Ministry of National Unity, where we have some stakeholders who deals with mental problems, especially like also when we see Mbuto Foundation with the support of First Lady of Rwanda. That is a great job for her. And I can say many things, but we have many settings which can help. And also, our government encourage people to also commemoration is also a powerful instrument to deal with a trauma, transgenerational trauma, to know the truth. So I can say about that only. Thank you.
So there are two more questions to make your life more complicated, Antoine. One is actually to everyone. I don't want to pile it all on Antoine. Politics has a role in genocide. How do you drive your message to the next generation, and how politicians feel about the grassroots? That's one. And one particularly to you, Antoine, uh, you said the person says it's anonymous, so I don't have a name for you. He or she said, I believe I heard from Antoine that it is important to talk about genocide globally. In the political climate in our country today, how difficult is this to do?
What I can say for the to tell the world about the genocide, I have I can say that, or I realized that it, for some genocide survivors, I can also say many of them, it is very difficult to express themselves or to say about their story, because it hurt the heart. Sometimes it's very difficult. I have I met some genocide survivors who didn't even able to go to the commemoration site, for example. So what I see, resilience is a journey. As Dr. Giselle said also, everyone he has her or his own capacity, or some of them also have low self-efficacy, for example, to deal with to deal with that pain. So what I can suggest is to let everyone to make or to be helped in that journey, and so that after she will be capable, or she will feel able to express. Thank you.
Samir Jamil adds another layer to this. And Samir, you do know, everybody, that we have many working groups at the center. One of the hardest working one is the Yazidi working group. We also have a Haiti working group. We even have a Rwanda working group, which is why we are holding these events. And you don't know, but you're going to have a lot of more work, dear panelists. But Samir is saying politics is the backbone of genocide victims' right advocacy. As in Iraq, unfortunately, Yazidi people did not gain any kind of good support after the 2014 genocide. So the case is in all of the world. That's correct. That is quite common. So it's not only Rwanda focused, but Rwandans. But this is a very legitimate question to ask. I see Annemiek. Annemiek, I see your references to Grace work with you. Yeah, these are classical studies. Thank you so much. Grace did speak in a prior webinar. And for everyone to know, we've had over 10 Rwanda-related webinars. So please study all of them on our website. each one of them is a gem, is a lot to learn from, and it's fantastic to see the developments of the nature of the questions. Well, we've done a lot of work, and we can continue, I promise. There was one question that came, asked the definition of resilience, which is a huge question to everyone, not only in Rwanda. Does anyone want to take that on? I told you that Giselle had to leave. Thank you, Giselle, for all the work you have done for us until now. Does anyone want to take that question? I also would like to see if, let's see if Donna is still here. Donatilla? I don't see her anymore. She's the one who had the vision of making sure that this webinar will cover resilience. We promised her, and I wanted to give her an opportunity to say something about about what she had in mind and whether this amazing panel lived up to her expectations. But
So can I say something?
please, Edmund, please, yes.
Yeah, I want to use books to talk about resilience. I just don't need to say that I have learned from different genocide survivors that they have resilience based on what they have gained from their parents before they died, how their parents loved people, so they decided to commit themselves to do the same. And others, as Antoine developed his resilience based on her mother's encouragement. So it's in living for those who are no longer alive. So when you hear testimonies like that one, you might find that despite all the adversities, the person is going to pursue a better life because he has the commitment, he has built an understanding that is completely different from what they have faced. Because the horror of genocide is not something that cannot traumatize anyone. So, but resilience is something that you get from the courage of your beloved ones, the memories that you have with them, and also the fact that you want to change the narrative, because the perpetrators wanted to have a narrative where you can't live, and you are now changing the narrative. You can live a better life. So that is what I have learned from different survivors I have worked with about being resilient. And lastly, one lady whose kids were killed, who survived alone, said that she loved her family to the extent that she doesn't have any place in her heart to put hate of those who killed them. So I did really like the way she explained that she has a heart that she's going to keep love for her beloved ones. I find that is resilience. Thank you.
Thank you so much, dear. there's one more question in the chat. Claudine, yeah. I can't wait to share it. Right. Yes, Claudine, very good. You clearly, the three of you should feel so satisfied because clearly this webinar will have immediate application to help people. Thank you, Claudine, for sharing that with us. And I would like to ask us now, I suppose, for last words. But before we say last words, clearly we will continue to work together. Clearly we will continue to learn, teach, to do our best to make the world a better place. There's one thing I wanted to share with you. In November in 2001, in Kigali, in Rwanda, we had Ibuka organized a meeting, a conference that was named Life After Death, Challenges and Opportunities. In that webinar, sorry, in that conference, at that meeting, we had representatives of all genocide groups. Next year, 2026, will be the 25th anniversary of that conference that, to me, to this day, was the best conference I ever attended. And I attended hundreds of them. I would like to do the same next year. I don't know if in Kigali, but I'm sharing it with you to start thinking where would be the best place to do this. So all of us are, all genocide groups are represented in learning from each other and perhaps teaching the world how not to do it again. So that's my last word for today, but how about we go from Antoine, and Edmund will have the very last. So Antoine, which would be your quote's last word for our wonderful audience?
My last word can be that even though we faced many painful circumstances or many problems, but we still have a way to escape or to face, to build the other future, a bright future. And also we should have courage and also to make an effort in our country to make also the unity, to enhance the unity and the hope, especially to the person who still have struggling or suffering from from trauma, depression. And even though we can help one person, it will be a great job. So I think we have to work together and to share experience, to visit them if possible, to make also, to do also a home visit of only on some persons. So as I finish, let's be innovative and look other system or other how we can make based culture support to our children, to our mothers, in general also to make or to do a big awareness to based on port corridors, especially because they are them who take some decisions which have impact to the general population. Thank you.
Thank you. Edmund, before you speak, George Mimba, who was exposed to the terrorism attack in Kenya on the United States embassy there, just wrote in the chat that he was in Kigali when the genocide took place. George, if you have just 1 minute, please. Robbie, would you let George speak? Go ahead, George, please.
Can you hear me?
Yes.
Yes, we can hear you, George.
Yes. First of all, I would like to thank the presenters very, very, very much. It's an experience that when you go through, then you sometimes don't even have the energy to recount all that took place. I was basically caught up in the whole thing when I came to work at the U.S. Embassy, Kigali. And I was actually in the hotel called Mill Collins.
Yeah.
When it happened, we ended up, the hotel was full. The hallway where the victims took refuge, and we had to open our rooms and share the beds, share the rooms with any space that we had with the victims who had actually taken refuge in the hotel. And actually, it was raining that day. It was raining and it was floody. It was heavy rain. And actually, the airport was closing. And so the embassy had to rush us to the airport before the airport was shut down. So it was, and on our way from the hotel to the airport, all you could see are bodies that were floating because it had really rained heavily. The bodies along the roads, the bodies that were floating, the people who had been killed, and us being rushed to get out of the place because they were evacuating the employees and especially those who had come from other countries to come and work at the embassy there. And so it was an experience, something that as I listened to the presenters do the presentation, I could really, it was just the whole experience coming alive. So I just wanted to say thank you. Sorry I didn't get to ask questions, that probably when we get to meet someday, then we'll engage more on that. But just wanted to say thank you. And that was a very, very good presentation. Thank you, and over.
Thank you, George. And you know that this morning actually was the launch of the Victims of Terrorism Association. Do you know that?
Sorry, no, I didn't know that.
So now I'm telling you. And so
you're usually on top of these things.
Okay, write me. I will send you the link. But
Thank you so much.
Also a little bit of good news for Rwanda, you know. And Rabbi, I asked you to put it in the chat. You know that yesterday a genocidaire was caught here in Long Island, in New York. So we didn't speak much about justice in today's webinar, but it's always related to whether victims heal or not. And maybe that is part of what we should believe and rejoice. So thank you. The announcement is now in the chat. And dear Edmund, I was taught that your name, Dufatanier, that it has a particular meaning. in Kenya, Rwanda, that shed some light on part of what healing is after genocide. So please include that in your concluding words. So share with those of us who don't know Kenya, Rwanda, what it means. And then give us the last word, please.
Yeah, thank you, Dr. Danieli. So I don't know how much we can thank you because you are the voice of many genocide survivors. So because all genocide survivors, they are now, even those who are resilient, they are facing the challenges of the genocide denial and genocide ideology. So having such webinar is one way to help them deal with genocide ideology. So my name, Dufatanye, means let's work together, be united. And there's no other way you can deal with the challenges and the consequences of genocide without being united. So in my presentation, I talked about the Genocide Survivors Association that helped many to heal the traumatic memories. And we need to be compassionate. We need to be understanding and caring for those who are using an unhealthy coping mechanism like alcohol use. And we know how much the government of Rwanda has put efforts to have professionals, to have services, to have infrastructure, and to be in schools, but we need to continue with community mental health approach to let people speak out and have safe space for them to be heard. Thank you so much.
Thank you. We simply continue the work. So I refuse to say goodbye. Let's say see you again soon. And we continue our dialogue. You got a lot of thank yous in the chat. I hope you reread it and enjoy it.
Thank you. We appreciate it.
My love, thank you to everyone.
Thank you.
Take care.
Bye-bye. See you next time.